So the recent CPIN Child and Family Emotional Wellbeing Training has just been completed for early years staff. Within the THT remit, this was really the first step towards multi-agency and joint working, wasn't it? So what I'd like to do is get some feedback on your experiences on the day, if I can. So what have you learned about partnership working amongst early years in Tower Hamlets?
I've learned that it's very important, that it can be done, that it's important for building bridges, and it helps better communication and understanding of each other's roles. I've also learned that when service heads commit to this, and also kind of middle management, then it has a kind of a knock-on effect and a domino effect down to the workers on the ground, and also of course, who will benefit but the service users?
Well, I guess the first thing is I was fairly new to Tower Hamlets when I started doing the CPEN role here, and what I would say is one of the biggest things is there is a definite commitment here with all of the early years networks that I haven't seen previously about integration and about being integrated and working together to get the best outcomes for children in the early years.
I think it's been interesting for me being part of the CEPN training, working together with health visitors and family nurse partnership people and children's centre workers. So it's been a chance to learn about how the different health professionals work together. I run a peer support programme for pregnant mums, and so we're involved in working with all the different health professionals. So for me, being involved in this working together movement, for want of a better word, it sort of fits for me because part of my job is knowing what all the different health professionals do, what makes them tick, their strengths and weaknesses, and trying to work out how we can work with them. So being involved in the work in Tower Hamlets working together and being involved in the CEPN training, it gave me a chance to work more closely with people from different disciplines and to understand them better. And I think I've learnt that everybody has similar pressures, but sees things from different perspectives, and that understanding each other's perspectives goes a long way towards being able to work together.
And in what areas do you feel you've gained confidence?
Confidence. Well, I think the confidence, there's two types of confidence here. There's the confidence in believing that it can work, and that in the organisation, confidence in the organisation that it can happen, and also there's confidence, I guess, in myself around being able to, talking specifically for the CPIN training, being able to deliver a training with other co-facilitators in a different discipline, and being able to do that and work together and to develop a meaningful and a valuable programme or training.
Well, I guess with the teaching, it was teaching people from a variety of different areas, a variety of different sectors. I had done quite a lot of teaching before, but it was mainly health related, so it was mainly with people in health. So it was getting that message across, and to lots of different groups at lots of different levels with lots of different ways of understanding. So it was just, I guess, confidence in teaching and learning with different groups, I think, was the main thing.
I think I've gained confidence in being able to relate to different professionals across the board. So being able to understand and relate to GPs, health visitors, children's centre, family nurse partnership, whoever, knowing that just because I'm working in the world of peer support and the voluntary sector doesn't make it better or less than. It's just having that sense of, as I said earlier, being able to understand their roles and be confident in the service that we provide. I think I've gained a lot of confidence over the last few years in working with different professionals. I believe very much in peer support, but I also see the strengths and the importance in all the other health professionals and disciplines as well. So I think it's that word, understanding and connection is, for me, the important thing. And so as long as you're confident in the service that you're providing, but you're respecting other people's services too.
Can you describe what the benefits would be for patient care in your local setting?
I think mostly it's around when things are joined up, and hopefully, you say patient care or service users, hopefully they will feel that things are joined up, and that the messages that they're getting from all the different professionals, they're kind of similar, and that if people are working in this kind of multidisciplinary way, and if the training they're getting is of stuff that's up to date and research based, then the people down at the ground level, the service users and the patients, the clients, will be getting good quality.
Well, I think there's loads of benefits to having integrated care. I think for clients and patients, when they step into somewhere, they don't know the differences a lot of the time between voluntary sector, between health, between, you know, lots of different services, and they just want one place where they can go, where they can get what they need. And I think that's the main thing about the integration, is making sure that the services that we provide are in places where people can access them easily, and making sure that that access is open to as many people as possible. And I see that as the main benefit, really. And also the communication. When people are co-located, when people know each other, they tend to communicate better, and that can only benefit patient care.
I think for patients who have different disciplines working around them, like the GPs, the midwives, the health visitors, the children's centre, peer support workers, if those disciplines are well connected to each other, understanding each other and communicating more freely, I think that will make the patient, the family, feel safer. It will feel a more positive atmosphere, and there'll be less chance of disagreements, of duplication, of the family maybe feeling atmosphere between different health professionals, and I think that will be more positive for the family themselves, a sense of feeling looked after, safe, secure, that people around them are in unity.
So the last question, what would you like to know more about in order to make joint working a success moving forward?
Joint working, it requires time and commitment, so it's a bit knowing about what is the commitment, and the commitment seems to be at the moment quite good from the strategically. Yeah, and how to make it happen, and the level of support that's there. People are pressured in their roles, so it's kind of how to make that happen in a way that's manageable and doable for everybody without them feeling pressured.
Well, I think it's a process, isn't it? And we're at the beginning of that. So it's learning about other teams, it's learning about what they offer, it's learning about the different services and how we can complement each other and we can work together. So not one service can provide everything. And we do have a high level of need in Tower Hamlets. So there's lots of children and young people out there and families with lots of needs. So it's making sure that all of those needs are met by all of the different services. So I think it's a process of learning about each other and how we can work together.
I think for me, I'd like to understand a bit more about the reality of the vision. What I understand a bit about the vision of place-based work. I'd like to understand a bit more about what that's going to look like, and the steps that are going to be involved along the way for all the different health professionals. I work in the voluntary sector running a peer support programme, so I'd like to know what that will mean for us. We have uncertainty in our funding future, so I'm kind of keen to know about that as well. And so for me, I don't want it to be just a vague aspiration. I want to know what it's going to look like on the ground, how it's going to connect together, and how peer support will fit into that.